Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Café. And today I have with me Stacey Shillington, and she is a naturopathic medical doctor with a focus on healing acne. And well, we're going to find out more about her story, but it all started in her 20s when she was devastated with acne and was considered incurable in her late 20s. So I think I'm going to stop it right there and wow. So tell us what happened, and what was your journey like, and how did this all unfold for you? And you have beautiful skin now. So
Thank you. And thanks for having me on. I'm really excited to be here. So when I was a teenager, when I was in my early 20s, my acne was moderate. It wasn't that bad. I did go on the birth control pill for probably about 8 years just to really get my acne solved. And at the time, I had no idea about natural medicine. I had no idea about how the pill affects the body either. So I was happy. And then I decided to go off the pill. And when I went off the pill, my face exploded in acne. And, it really changed my life. It changed the way I thought about myself. It changed my personality and the way I interacted with people. I went from being, pretty outgoing, pretty successful, to hiding away from the world. I didn't want anybody to see my face. I was so traumatized by my acne. And of course, I went to see my doctors. All they wanted to do was either put me back on the pill or put me on Accutane. And neither one of those options really sat well with me. I was in my late 20s. I was married. I was thinking about potentially starting a family in the future. And I was very into yoga as well. And, I was more on a journey to heal my body versus medicate it. So, I tried a lot of different diets. I tried a lot of different supplements. I tried a lot of skincare products, spent thousands of dollars. Nothing was working. And then finally, I went to see a naturopathic doctor. And the naturopathic doctor said to me, she said, you know what, this is not a problem with your skin. This is a problem with an imbalance within your body. Something's not balanced. Something has to be balanced. And that was like an aha moment for me. It really was. That was the moment where a light went on. I was like, of course, we have to balance the body from within to heal it. And I was hooked. I mean, it was still many years before I was able to solve my acne for good, but I went back to school. I became a naturopathic doctor. And for 12 years, I worked in clinical practice healing acne, and always doing it by addressing the root cause, solving acne without a lot of skincare products, without medications, helping women come off the pill. Helping women that have been on multiple rounds of Accutane finally free themselves of that and heal their skin.
Wow.
So that's what I've been doing, and I love it.
So, I mean, we're both naturopathic doctors, right? So, but a lot of people don't really know what we do, and when you say that acne is not a skin problem per se, that there's more to it. Can you expand on that a little bit so that it's really clear? Because it looks like it's on the skin. So what's really going on? What did you discover in your journey and with working with a naturopath and your own training?
Yeah. So, it very clearly looks like acne is a skin problem, but it's actually a really complex condition that involves many different organ systems in the body. And I always say there's like 4 main root causes of acne. Number 1 insulin dysregulation. That's a big one. When insulin levels are too high, you're creating a hormone called IGF-1, and IGF-1 has been shown to directly increase androgens, the hormones that cause acne. So, that's a huge player. Another huge player is poor detoxification. When we're not able to detoxify our bodies properly, a number of things happen, but acne can definitely be a result of that. And we're talking about the liver, and we're talking about the lymphatic system. The health of the gut is another very, very important thing, because the skin and the gut both share the microbiome. So if the gut is not healthy and the microbiome is not healthy, then the microbiome on the skin is not going to be healthy either. And the other pillar is poor stress management. When we're not able to manage our stress properly, high cortisol levels actually trigger 3 different biochemical pathways in the body that can lead to acne. So, those are the root causes that I always address when a patient comes to me with acne. And, sometimes it's not all of those root causes that are at play. It can be like 1 or 2, or maybe all of them. But, that's what I mean when I say acne is not a skin problem, and it goes much deeper.
Yeah. And I think it's very indicative in the way that the conventional paradigm is where it is where it's at, and we're always looking at the one organ or the one place, and then dealing with it by literally masking it. No pun intended there with skin. So it's interesting to give the perspective that, in a sense, when we have acne, it's already a symptom of the disbalance, and I think that's the key. It's like, stop looking at it like the problem. It's actually your wake-up call that there's something else that's wrong, right? And when you don't treat it, so you don't treat, I'm not going to talk about the acne per se, but when you don't treat the root cause, what have you found? If you just, let's say, oh, it's vanity, I don't care about it, I'll just leave my acne. What else is in store for these people who don't look at their acne as something they must address?
Yeah, I mean, it depends what the root cause is, what's really going on to create the acne in the first place. But, when there's insulin dysregulation, for instance, that says that there's a metabolic condition, happening in the body. And we all know metabolic conditions can end up with something like diabetes, right? Cardiovascular conditions, so it is it's like a little red flag that's being waved, like, fix me, something's not in balance. And when you don't fix it, it is going to become something bigger in the future. And, same with the gut. Acne is a sign the gut is not in great shape. If we're not healing the gut, if we're not balancing our microbiome, we now know that, certain cytokines are stimulated in the gut, and that causes mass inflammation throughout the entire body. And inflammation can lead to pretty much any chronic disease out there, depending on, how your body manifests inflammation.
Yeah. So you have 4 categories that you mentioned. So how do you go about with each category, sort of assessing, in layman's term, but what is it you do, what's available to people, just to get the full picture of what the journey for a patient would be if they came to see you?
So the first thing that I always address is diet. That's the foundation. I need to heal the gut. I need to balance the blood sugar. And that comes with removing any aggravating foods, any inflammatory foods, and establishing an eating routine that, is very balanced. So you're not eating a high sugar diet. So you're not stimulating those insulin levels all the time. So I always start with diet, teach my parents. Maybe my parents need help, but with their diets, I think they do. But, you know, really teaching them how to eat an anti-inflammatory diet. And usually I get them on an elimination diet to begin with as well. So we can take out the foods that are aggravating them. We allow the gut time to heal and, you know, just really balance the insulin levels. And, you know, then I do add supplements in one at a time, very carefully. Acne patients are so sensitive and their bodies can be overstimulated very easily. So only ever one supplement at a time. And, you know, I'll definitely support the organs of elimination, the liver and the lymph, heal the gut with a good probiotic. And then with stress management, I mean, that's a really, I mean, that's the most difficult thing to teach people. You know? It really is.
Yeah. Yeah. No, I remember I'm sure it was different when you were learning, but we had stress management classes. And yeah, I can't say that there wasn't a great deep understanding of what stress is, and really what we can do as individuals to deal with that. What are the things that you find that people easily adapt to, that they can actually do when you suggest stress management?
I'm a huge meditator myself. I'm a huge yogi. I'm a huge meditator. So that's a huge part of what I teach my patients. And I can teach it and I love teaching it, but you know, it's up to them to implement it. So that's always the hard part when it comes to stress management, because meditation works. Meditation is like a game changer, for sure. So that's kind of one of the top things I teach. The other thing is gratitude, you know, and that's an easier practice to implement. And that is very powerful as well. And, you know, acknowledging 3 things that you're grateful for every day for 21 consecutive days has actually shown that it helps our sympathetic nervous system transition more easily into a parasympathetic state. So that's something that I really, you know, want all my patients to integrate into their lives. So I teach that as well.
Yeah, no, I find that it's easy to do, but it changes even more than the physiology. It changes the way you're perceiving your life, and the things that used to be triggers become less triggers because you don't notice them anymore. Right? That's just the way our perception works, right? So it changes deeply and radically, to use techniques of gratitude. And they're not techniques, it's actually noticing what, if we take the time to be grateful, there's so many things we can be grateful for.
Absolutely.
I was going to say one of the things, because I'm in full agreement with what you're saying, even though that was not my specialty, was pain. Well, actually, we're not supposed to use the word specialty, so I'll take that back. My focus and who was attracted to me.
Yeah.
are people. We have a lot of laws, so just if people are listening to this wondering why, but anyhow. So,
I know
so,
it's hard to keep track of everything.
There's a lot of pieces, you know. So and even focus. We're allowed to have a focus, but because naturopathy is so complete and holistic, we could say we can treat just about anything, because that's actually the truth. And yet, from reaching the people who we can help the most, from a marketing perspective, you need to be very specific so that people can find you. And especially like in your case, where you have a story that is totally dear to your heart and an experience that you have, you know, gotten to the other side of, it makes sense. And yet we can't say specialists. So it's kind of funny. Anyways, but
I know.
Back to my pain point. So my pain focus, one of the things that I realized is that I use something called Bowen therapy to put people into that parasympathetic state. And it's one, I'm sure you've heard of it, but it's something that is also very effective for people to relax, and it shifts things. And once you're in parasympathetic, that's really where people heal.
Mhm.
Right? We're in this driven, sympathetic, overdrive, overstimulated state. And once we turn into parasympathetic, we digest better, everything happens. We heal better, we repair better, and our bodies are made to heal, right? So that's my little secret in switching that as well. But meditation, I want you to speak a little bit about that because it's a lot of people are so afraid of it because I'm not going to sit there and I'm going to have all these thoughts come through. What is your version of what works?
Oh gosh. And I've had a crazy journey with meditation too. As I said earlier, I'm a huge yogi and I've been doing a daily yoga practice since 1995, which is a long time. And, I've always tried to do a meditation practice as part of my yoga practice. That's always been my goal for many years. It was incredibly difficult for me to do this because I would sit in meditation and my brain would go insane and I could not rein it in. And so I thought it's clearly not for me. Meditation, I can't do it. And, I had a lot of stressors going on in my life, especially in my 30s. One of the symptoms of my stress was insomnia. I was a huge insomniac, and all the stress of my 20s and 30s accumulated to a point where in my early 40s, I had 3 massive stress-induced heart attacks. And it was
Wow.
due to a condition called SCAD. And SCAD is very rare, but it's called spontaneous coronary arterial dissection. And it is caused by excess stress. So I was just a stress case. And, when I had these heart attacks, I had 2 little children. And I'm like, I have to do something because I want to live to see my children grow up. And I've got to do something radical in order to shift my life and take control of my stress levels. And the only thing I could think of, the only thing that I knew would help me would be meditation. And so I had no choice. I was like, I have either got to start this meditation practice or I am not going to be here to see my kids grow up. So I started every morning, every afternoon for 20 to 30 minutes. I now meditate. And at first it was super difficult. I do the type of meditation where I repeat a mantra silently inside my head. And it can change the mantra, but I find that because my brain was initially so scattered and so all over the place, repeating a mantra, sitting on my yoga mat, breathing, focusing on my breath and repeating this mantra really, really helped me focus my attention and calm, that voice inside my head. And so I've been doing this daily, twice a day, for about 5 years now. And it has radically, radically shifted my life, shifted my stress levels. I haven't had any heart symptoms since. And, it saved my life, really. Meditation is a game changer. It can change your life. Unfortunately, I had to have a life-threatening situation happen to me to get really serious about it. But that is how I do my meditation, and that is how it has affected me.
Yeah, wow, quite a story. My goodness.
You had no idea, did you? You had no idea what was coming when you asked that question.
No, it shocks me, but not really, because the thing is the passion there to help other people. In my mind, usually comes from the absolute passion that we had to do ourselves in order to exist or to survive or to to get past whatever our obstacles were.
Hi, it's Dr. Manon, and I just wanted to take a moment, commercial break, to ask you to subscribe to my podcast and kindly leave a comment if you're enjoying this. And also, just to let you know, I have tips for people in health looking for solutions to just a variety of issues. It's more like an attitude of health. And they're entertaining short videos, and you can find those under drmanonbolliger.com/tip. The link is here, and I look forward to hearing from you.
Yes.
So I think that's how we find passionate people in this. It's not just like, oh, we can fix people with natural things. I think the passion comes from a much deeper knowledge, deeper desire, and a truth that really leads us forward. Yeah, and interesting. Wow. Okay, well, let's see. Where can I go with that?
I know. Sorry about that.
No. It's great, actually. Well, no, let's go a little bit deeper. Just because I do find that the journey, and this is conversations about health, right? This is basically what we're talking about. What is health to you?
Yeah, that's a really great question. When I feel healthy, I feel vital every single day, having energy, being able to do the things that I want to do with, a sense of peace. I think that's it, because, in my 30s, when I was doing yoga every day, I was taking all the right supplements, I was eating all the right foods. I thought I was super healthy, but I was also incredibly frenetic. That was not health to me. But feeling really vital and being able to feel that way while having a calm, healthy mindset at the same time, that's health to me.
Yeah, no, that's interesting. It's not very different from my definition as well. And I actually sign my signature in health and joy.
Oh, beautiful.
Because for me, joy is that it's a peace of mind, but it's almost like the enthusiasm of life leads you to this. It's like an effervescent feeling.
Yes.
That's that feeling that I feel, and I think when I look at the paradigm of, I guess it's called conventional medicine. I'm not sure, because we can't say traditional. That was not the case. So it's a fairly recent system, and this is not about doctors just out there, because everyone I've interviewed goes into health and into the healing profession because they want to help people, right? And it seems like we're all drawn by either some personal experience or a family member that could not be saved by the system that existed, or the choices they made, or all that. So there is quite a drive in the profession of helping people. And now I just realized I went in a loop and I forgot my initial question. Oh, well, I'll just take that as, whatever it is.
Yeah.
Anyways.
Well, it's so true. It's so true. Yeah.
But so the transition for you and then why I asked what you think about health is that in this modern paradigm, we're taught that it's the elimination of symptoms. In a sense, it's like removing what the body seems to say to us to wake up, right? It's like that's the problem.
Yes.
Instead of going deeper, and that's one of the issues. But the other part is that it's the expectations of the patient. The patient thinks the best they can have is the removing of these annoying symptoms,
Mhm.
right? And so I find it really important to educate people to expect more,
Oh,
to
yeah. Yeah.
want more out of health and
Yes.
more out of life, right? So
Yes. And I so agree with that, because in my patient population, people come to me and they just want to get rid of the blemishes on their face, right? This is it. Like, if I can do this, they're totally happy. But after I've been working with them for a while, they're in shock, because they're like, wait a second, my periods are regular. I don't have any PMS. I don't have any constipation. I don't have those headaches anymore. I feel so amazing. Like, and they are so surprised and so shocked that all these changes are happening, when really all they wanted was their skin to be clear, you
Mhm,
know? So yeah, I totally know what you're saying when you
mhm,
say that. They only expect this ever. They have
yeah.
no idea that we can do more, that we can up level their health so dramatically.
Yeah, and that's why, acne seems so superficial, and that's why it's like I'm so glad to hear the depth of your passion and your knowledge, because um, yeah, you would think, oh, just get rid of that, it'll be fine. Pain is a little bit different, sure. Get rid of pain and you'll be fine. Well, yes, there's much more understanding that if we can get rid of pain.
Mhm.
But of course, if you do it in a natural way, then you don't just get rid of pain, you change the person's life altogether, right?
Yes.
So the depth is there, but if people can imagine their lives being better if they're not in constant pain,
Oh yeah.
right? But acne, it's more like, I would think it's just like, get rid of that. So,
Oh yeah.
so
Yeah, they just want clear skin. They don't
yeah,
care, you know.
yeah, yeah. So,
But getting clear skin is such a game changer for
mhm,
so many people. I mean, my patient population is mostly women, um, experiencing adult acne, and the emotional and mental
mm,
toll that acne takes on women is, well, and men, of course, but I'm talking about my patients, is just so, under recognized,
yeah.
and there's research studies that show that women with acne have higher levels of anxiety, higher levels of depression, lower levels of self-esteem. It's well documented, but it is it's a serious medical condition.
And is the anxiety and all that
Mhm.
because of the society that expects women to be glossy, to be voguey, to have everything like that? Is it that, or is it that there really is stressors that people or women in your case manifest through their skins?
Oh, and that is such a great question. And I observe my patients and I ask them questions. And, I'm still formulating my own personal theories on this, but I really feel that a lot of women that experience acne, there's a deep shame within them that pre-exists before the acne. And then when acne does come, I mean, it causes so much mental and emotional trauma that it just exacerbates the acne. So, I see shame as such an associated emotion with acne all the time. So much shame.
Mhm. Yeah, I'm not surprised actually. Yeah.
Mhm.
Yeah, it's definitely not been my focus. But if I think back of the patients who may have had pain and acne, for example,
Mhm.
yeah,
Mhm.
I would concur. That's interesting. And
Mhm.
it's funny because it's almost, you could say, it's easy to be the victim of that and say, look at that, I'm already feeling shame and now I definitely can't show myself.
Mhm.
You can justify it, but
Mhm.
often diseases are or conditions are your way of transgressing, of actually transforming
Mhm.
your
Mhm.
reality.
Yes, yes. Yeah, that's so true.
So I would imagine that as you help women not just get rid of their acne, but actually heal more fully, that the shame disappears. And you could say, well, it's because the acne is not there, but healing is so much deeper.
Yes.
Mm.
Yeah, I know it is. It's reaching such a deep level, when you're able to affect somebody's shame and, allow them to recognize their own beauty and their own worth and be able to, you know, establish boundaries and, understand things they've never understood before they've had to like go through this journey
Mhm.
of experiencing acne and healing acne. And I really call it a clear skin journey because it is a journey. And, a lot of times with some of my patients, we're almost there. We're almost there in the healing. They're doing all the right things with diet. They're doing all the right things with, doing great supplements and, but they don't get there until, and I've heard this so many times, they learn to love themselves. It's like the final piece of the puzzle for so many women to be able to look in the mirror and say, you know what? I'm beautiful. Even if I have this spot on my face, I'm still beautiful. And when they can get to that place, I swear their acne disappears.
Mm. Yeah.
I've seen it happen so many times. It's like the final piece.
Yeah. Well, it does come to that inner work and that self-love.
Mm-hmm. Mm-hmm.
Yeah.
It really does so much of it.
Yeah. So it's interesting. Yeah. It's healing is a journey, right? It's
It's a
not a
journey.
superficial thing. And I think that's one of the I think the opportunities in what's happening in these times, that people need to self-reflect much more deeply
Mm-hmm.
about what's going on for them, what's going on with their job or lack of, what's going on in their relationships,
Mm-hmm.
and all of that. And it's, at least I've found, that many times a very unhealthy relationship is a deep stressor to a person's health. And if they're already experiencing shame from before, because usually that starts much earlier, then these kind of relationships can exacerbate the condition that you have, that you're prone to, right?
Yeah.
And I think that's where the healing is always a journey. It's not about removing symptoms.
No.
It's working on our entire body. And yet we're still programmed to think that the problem is out there.
Yeah, I know. I know. When in fact, our symptoms are our friends. Our symptoms are leading us on a journey, to learn more about ourselves, learn more about our bodies. Like, it, acne was one of the greatest gifts that I ever had. It has given me so much. Like, I'm thankful for acne every single day. And, I really encourage my patients to think of it the same way. It's not this big bad thing that needs to be like eliminated. It's your body talking to you. It's a message, and it's something we need to listen to, with empathy and with love.
Exactly.
Yeah.
I think that's the key, really, with empathy and love, and with openness, so that we can discover
Mm-hmm.
what's behind that. How are we made up? Because we're not simple beings in that sense. It's not
Yeah.
one straight road. It's so many pieces that unfold. And I think there's such a joy in healing.
Oh, yes, I agree with you. It's so beautiful. I get so excited about it. I do. I really get excited about like healing. It's so much, it's fun. It's a really good time.
Yeah, a good time, which doesn't mean that it's all roses, right?
No.
That's the thing, is we have this idea that covering it up is is done, and it's not. And healing is like, oh, it's going to be all pain, or it's not. It's a journey. It's part of our life, really. And
Yes.
just like transformation is.
Exactly.
So I noticed that you have is it a 7-week program? It's 7-week clear skin program. Why don't you tell us just a little bit about that so that people who are interested can find out more?
Yeah, absolutely. So my 7-week clear skin program is an online program that I offer for women that are interested in healing their acne from the inside out. And so I share my protocols, and my wisdom in 7 different modules as to how to start your own healing journey to heal your acne from the inside out.
Wow, that's great. And does that involve like having access to tests and things to guide, or is it more of a transformational work, or what type of training is that?
Yeah. So, I mean, to do a lot of, to do the testing and to really, work with me one-on-one, I offer a coaching program.
Mhm.
And the 7-week clear skin program, I really share the culmination of my experience over the past 14 years, what works with diet, some
Mhm.
great techniques to help your body detoxify, some great techniques to help you heal your gut. It's more of a self-directed program.
Mhm.
But to really get all the testing done, personalized supplementation, then you can work with me directly.
Mhm. Yeah, because it's not one size fits all.
Yeah, yeah,
Yeah,
exactly.
but it's definitely so really important to understand that also the mindset and the things that we can do on our own, right? That's
Mhm.
it's for me that's so important. I for me my vision, and I think I told this to you when we talked earlier, it's a healer in every household. It's
Mhm.
finding that healer within,
Mhm.
because it starts with that. And once you start to see all the things that actually change, then it makes so much sense, to see an expert who, or I think we're not supposed to be experts either.
What are we anyways?
I don't know. I just discovered that as a naturopath, I can't talk about the immune system. So it's like, okay, that's news to me.
Oh no. Oh
It's
no.
the foundation of so much of what we've anyway. Whatever. There's bodies of regulations apparently for public safety, and it gets complicated sometimes. It's just like everything. It's not straightforward.
Yeah, it's really shocking that as naturopathic doctors we're not able to talk about the immune system.
Hmm.
Yeah,
Yeah.
it's
No, it is. It's an interesting thing, and I think yeah, I don't know. I actually don't understand it sufficiently. Um, and we had such an opportunity as well, at least the way I see it, when people are in so much fear about this virus. For example, every other year when people don't want to get the flu, or they don't want to get a virus, or they don't want to get something, you tell them, eat well, look after your body, do things for yourself. You go back to self-care. And interestingly, this time it's not a subject to be discussed, which is, it's very interesting for me to notice that. And it yeah, it saddens me, um yeah, to be part of the disempowering of people when healing is such an empowered act. So
yes.
yeah.
You're right. Healing is empowering.
Mm.
Yeah.
Yeah, no. So anyhow, it was really lovely talking with you and finding out a little bit more about your program. And we're gonna have a link. Where are you located for those who
I'm
have?
in Toronto.
You're in Toronto. Okay. So
Yeah.
okay.
I'm in Toronto, so I'm in Canada too.
Yeah. And
Mhm.
what's the name of your clinic?
I work at a clinic, Midtown Toronto, called Rosedale Dermatology Clinic. So I actually work in a dermatology clinic.
Oh,
Um, yes,
very
and I also do online consults as well.
yeah. Okay, great. Okay, well, I'll definitely put those links so that people can reach you. And then you have your program as well. And anyone who's listening, acne is a thing. And as you mentioned, it is often seen as something that can't have a huge impact. And I think you've definitely shown that it has a massive impact, especially on adult population. Yeah. So
thank you so much for having me on. It's been super fun to talk to you.
Well, thank you.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.